طيب السلام عليكم ورحمة الله وبركاته. Hello everybody, good day or good evening. So welcome to our webinar today. My name is Lamia Al-Hazani. I'm the head of patient empowerment at the Saudi Patient Safety Center. You will be hearing a presentation from our speaker today, Prof. Samia Al-Amoudi, who will be speaking to us about dilemma of consent and patients' health rights and its impact on patient safety. Dr. Samia, she is the founder of Health Empowerment Initiative and Health Empowerment Unit at King Abdulaziz University, Health Empowerment Consultant at the Saudi Commission. She is a professor and consultant of obstetrician gynecologist, founder and former CEO of Al-Amoudi Center for Excellence in Breast Cancer Care at King Abdulaziz University. So now moving along to our session, please welcome Dr. Samia Al-Amoudi to deliver this presentation in very timely subject. Welcome, Dr. Samia.
Thank you so much, Lamia. Assalamu alaikum jami'an. Good evening, everybody. Good afternoon, good morning. I don't know the time difference. Welcome all. I'm really very happy and grateful to the Saudi Center for Patient Safety, because when we talk about health empowerment and health rights, and particularly when we talk about the dilemma of the consent, the first thing that we target is the patient safety, because what we are doing, it has an impact on patient safety. Why is this session, why are we talking nowadays about health empowerment? This wasn't the case a few years ago when I graduated, for example. I've graduated in 1981. There was nothing we have studied ever or discussed like today about health rights and these things. We've noticed from the practice and during the our work that there is sometimes the healthcare providers, the students, and the community, they don't have enough knowledge, or they're not empowered in a clear way with the health rights, policies, regulations of the Ministry of Health. And this lack of knowledge is the one which is causing or ending with morbidities and mortalities, as well as it might put you in medical legal problem just because you are not aware of this. From here, we are today, we would like today to take few cases as examples, which are from the daily practice, to discuss these issues, discuss the rules, the regulations, maybe internationally, but of course, the difference between the rules and the regulation in Saudi Arabia and the Muslim countries is that there's as well the religious perspective that we add sometimes if the case need that one. So this is the why we are conducting this webinar. Okay, Dr. Lamia, تفضلي.
So now we're going to talk about the first case, which is under the topic confidentiality, privacy, and security of patients' healthcare information. So the case stated, a 40-year-old man came to the emergency room complaining of dry cough and difficulty in breathing. His temperature is 38 degrees. You are suspecting coronavirus or COVID-19 infection. The patient requested from you not to tell anybody about his illness and threatened he will write a complaint and sue you if you disclose the diagnosis. So you as an audience, as a healthcare provider, how would you deal with such situation? So the first option is respect the patient autonomy and his request. Tell the family privately without his acknowledgement. C, explain to him that the rules of MOH or Ministry of Health oblige you to disclose his diagnosis to authority and family. D, document this in the progress note to take an action from the senior consultant in the ER. So now to answer this question, I'm going to raise a poll question, and you can answer there. So as we said, the first option is respect the patient autonomy and his request, or should we tell the family privately without his acknowledgement, or explain to him that the rules of Ministry of Health oblige you to disclose his diagnosis to authority and family, or document this in the progress note to take an action from the senior consultant in the emergency. So we encourage everybody to answer this question. We will give the audience 60 seconds to finalize their answers. So around 50% of the audience are answering. We would like everybody to participate and share their point of view in this question. Okay, so Doctora, now you can see the answers.
Right. Thank you so much, Lamia. Well, as it is expected, that we are still having a problem with the rules and the regulation and understanding the rules and regulations of the Ministry of Health. First of all, 54%, they are the one who knows or who gives the correct answer, that we will explain the rules, and we will discuss this in a bit of detail. Unfortunately, 33% still thinks that this is one of the autonomy rights of the patient, and they will follow his request. Tell the family privately. I'm glad that only 5% will hide this information, and they will talk without acknowledging the patient. Documentation is a must. Now, let's move to the discussion, please, Lamia. This is the case that, to be honest, this is one of the cases that we all face in the practice. You might be in the ER, you might have a patient who is a friend, who is a relative, and he will request that thing. First of all, we have to know that by rules and by regulations, can we go back, Dr. Lamia? Yeah. By rules and regulation, we are not allowed to hide this information or go with the request, because this is not part of the autonomy. But it doesn't mean that we are going to tell the authority without telling the patient. Always, always, please counsel the patient out of respect, out of right. I have to counsel my patient, explain to him that I do respect his right, but I cannot follow his request, because as well as a healthcare provider, I'm obliged by the law of my Ministry of Health to report such cases. And you have to be careful, because nowadays there are laws and rules which are very clear, and there is, it's not only that you might be subjected to investigation, you might be subjected to penalty from your the hospital or from the Ministry of Health. So you have to be extremely careful. Why do we have these rules? Because the case here is totally different than other cases. This is a contagious disease. This is a case that if you hide the information or the diagnosis, your patient will have in the ER, for example, and this what happened in a number of cases of COVID-19. The patient in the ER will be seen by the doctor. He will be seen by the nurses. He will be seen by the technician to take blood, the X-ray technician, maybe students, and this is a contagious disease. So this is not the case of respecting autonomy. We call it in Islam ad-darar al-mutaaddi, that this will impact the others around the patient. Next slide, please. And it's not only that, the family members, the close relatives, they have to be tested as well, as you know, to make sure that they are not infected. Is these rules are rigid? No. You as a healthcare provider, you have to know when to keep the confidentiality, because we agree that confidentiality comes first. And we swear on graduation the oath that say that we will protect the secrets of our patient. But by law, there are as well cases which are exceptional. For example, to report criminally case, if you are suspecting that there was a crime, there is something serious, or to prevent a crime, then here the confidentiality is not number one. To report a contagious or communicable disease, like we have said, Corona, COVID-19, AIDS, because those who are around the patient will be affected. Suppose that this patient or other case, they go and sue you in the, you have a medical legal case, you've been called to the court because the patient say so and so about your management. Here, the health rights as well of you as a healthcare provider and the confidentiality and the rules allows you to write the diagnosis and to defend yourself. And of course, if the patient agrees, that you tell the others and the family. So autonomy is highly, highly valued in medicine, but these are the cases and the exceptions in which case confidentiality is not, confidentiality comes first than the autonomy of the patient. So this is why 56% of you, they have answered the correct answer, but still we have around 40% who are not aware of these rules and regulations. Okay, so this is the first case. Right. Next case, please, Dr. Lamia. Yeah.
Okay.
Go ahead.
So, yes, thank you very much for elaborating the first case. Actually, I don't have anything to add in the discussion that you made to our audience. So in this case, we're going to talk about the right of the both partners to know about the results of premarital test. So the case is a couple are planning to get married, and premarital test was carried out as per regulations. The husband HIV test turned to be positive. So what would you as a healthcare provider tell the couples about the results? Does he have the right to hide this information from the other partner? So the first option is you will disclose the results to the man privately. You will respect his request and not tell the other partner, or you will explain the results to both partners. So I will also raise this poll question, and I would like everybody to share their opinion. So the poll is now posted. I will give our audience about 60 seconds to answer this question. So in our country, we have the premarital test that is being done before getting married. Not in every culture, but in our culture. So after this test, the husband or the man was HIV test turned on to be positive. So what would you do in that case? So Dr. Samia, if you would like to comment on the answers.
Yes, first of all, the premarital test in Saudi Arabia, this is one of the new regulations, relatively new, that are issued to protect the families from all the diseases, and this is a way of prevention so that we know if the couples have problems beforehand. What's very interesting in your answer, the audience, The last question that you will explain the results to both partners. It's amazing because the balls here, it shows me the percentage and it's moving up and down, up and down. 67%, they will explain to both partners. Then 77%, it raised to 77%. Then it goes back to 67%. As if somebody is still hesitant, not sure that he has to explain to both partners. Now, you will disclose the result to the man privately. This is not acceptable. This is not acceptable because the other partner, and when I say the other partner, maybe the female is the one who have the problem. The same applies to her. It's not because male and female. If she has the problem and she asked you to disclose the information to her only, here 11% agrees. This is not acceptable because this is why premarital tests, they are done for both. Number two, you will respect his request and not tell the other partner. As well, there is impact on that one because if you explain to them, and we can have the next slide, they might rethought about this relation. They might not carry on with that marriage. And I will give you example now. Lamia, yes, the couple, first of all, both of them, they have the right to know about the results, okay? As I said, it might affect decision to get married or not. I have seen cases who have problems, like, for example, I remember a case of sickle cell anemia. Both of them, they were carrier. Few cases, they will choose not to carry on with the pregnancy, with the marriage. Why? Because this is the objective of, or the aim of the premarital. We sit with the couples, we counsel, we explain to them what does it mean to have a sickle cell trait? What will happen to them if they get married? What will happen to the kids that they have? It's an agony. Every week they will be in hospital for blood transfusion. The kids will suffer long time suffering. But what I would like to make very clear that when we counsel the patient, we counsel and advise, but we do not have the right, not even the consultants, the system does not interfere with the decision. Yesterday, I was giving a lecture and somebody asked one of my students, he said, so we will tell the, we will prevent them from getting married? No, we do not have that authority. We do not have that right. Our job is to explain. Maybe they are in love, they know the consequences and they want to try their chance. Like sickle cell, 50% will be affected, 25% carrier, and 25% will be, well, they will say, okay, we will take our chance. So we do it to counsel them, to empower them with knowledge, but not to take decision. The same thing for AIDS, as we have said, for sexually transmitted diseases. The only thing which is extremely important as well for us as healthcare provider, it's my duty and your duty as well. If you have a patient with genetic problem, like for example, muscular Duchenne syndrome, other genetic disease, people doesn't know that there are tests for these things. They are not routine tests, but if you have a couple with history of previous delivery of genetically affected baby, then we have to tell them that nowadays we have the pre-genetic diagnosis, we have options, etc. And the most important advice that I give and everybody gives to these couples, always I say, okay, listen, this is the result. We counsel, we explain to both partners, and from ethical and Islamic view perspective, we have to advise them to keep the privacy of this information, whether they get married or not, because unfortunately, maybe the husband or the wife, the one who are doing the test, she will just leave the clinic and will go to her family or call her family. I'm not going to get married to this guy. He has AIDS, he has infection, he has herpes. This is not, the ethically is not acceptable. So you have to understand, and this is the premarital test. This is the way we counsel the patient. So 77% in our polls, they said they will discuss it with both, and this is the correct answer ethically and from the health right aspect. Okay?
Yes, Doctora, we have a comment here or a question from Haneen or Doctora Haneen. She's saying, can we just say no matching without any details?
Right. Here, maybe I would always say that if they, if the couples tell you that we don't want to know the results, we want just to tell us whether there's a matching or not. This is their right. If they want, they don't want to, and it's not by force that I'm going to explain to them. Okay, so always we have to share the decisions with the couples, but usually they receive the result. And most of them they will take the results, and these results, it's good as well for the future marriage. If they are going to get married, if he find that or she find that she is sickle or whatever, that she will, for example, if she if they have infection, then we will refer them for further treatment and management. It's not only that we'll give them the result. Okay.
Doctora, also, I think, for example, the healthcare provider did not disclose the case of the male to the wife. I think when they take the paper to the, what do you call him, a katib al-adl, who is going to write this marriage, I think he needs to disclose it with both parties, the female and the male, in case the healthcare provider did not say anything. I think the religious man who will write this contract, this marriage contract, he will tell that both parties what's medically ill with each one of them, right? Just
no, with all my due respect, this is the part that the doctor is the one in charge of, because he is the one who could give them the right, correct answers and counsel them properly medically. Like sometimes, for example, and you have to be very careful. I mean, my colleagues, maybe the husband will tell you, okay, khalas, give me the result and I will discuss it with her. Or he will say, okay, give me the results and I'm not going to continue with this pregnancy. This is not acceptable. You have to make sure that you follow this aspect, and you have to empower them with the knowledge. And this is health right for the couples. It's not the religious people responsibility to explain what we did not explain to them, because the doctors is the one who has the experience and the knowledge to counsel and to tell them what does it mean. The religious man will not understand, for example, the risk of some genetic disease or sickle cell anemia or whatever.
Yes. Okay, so let's go to the next case. So we're going to talk about who have the right to consent for treatment. So this is a cancer case. A 50-year-old woman was diagnosed to have ovarian cancer and will need chemotherapy treatment. The family objected when the doctor wanted to obtain informed consent for the patient, because that would involve disclosing the diagnosis, which would make the patient very sad and depressed. So the family wanted to make the decision without informing the patient. So what should the doctor do in that case? Either respect the family wish and not tell her about her diagnosis, or disclose the diagnosis to her and the family together, or disclose the result to the patient, and she has the right to tell or hide information from her family. So I'm going to share the poll question here. And I would like to invite every participant to participate in this question. So again, what would you do if the family tells you that we would like to keep this diagnosis disclosed from the patient and just inform us about the treatment, and we will sign the informed consent on behalf of the patient? What would you do? Are you going to respect the family wish and not tell the patient about her diagnosis? Or are you going to disclose the diagnosis to her and the family together? Or will you disclose the results only to the patient and the patient have the decision to tell the family or any member of the family? So even if you are a healthcare provider who never worked in a cancer center or oncology department, just imagine that you are in this situation. What would you do as a healthcare provider? Okay, Dr. Prof. Samia, you can see the results here.
Yeah, very interesting. Again, it's in the range of 60% that will give us the correct answer. Believe me, this is a case that we will see frequently. You will find that you are sitting in a clinic and the sons and the daughters bring their father or the mother, and they will talk to the doctor and tell him, please, when you get the results, don't tell my father or don't tell my mother. They will not tolerate the shock or the having cancer, this crisis. So once you get the result, please tell us the result and we will tell our father or mother in our best way. This is not because they are trying to control their parents. No, it's a paternal attitude, that overprotection. This is the overprotection when the sons or the daughters, they think that their father or mother, because of age, because they are elderly, they cannot tolerate the shock of such a diagnosis. And I always say we do underestimate our patients, whether they are young or age, because subhanallah, let me say it in Arabic, يعني Allah يبتلي ويدبر. You will be imagine the response of the people who receive the diagnosis, how the response will be amazing sometimes. Number two, nobody has the right to receive the diagnosis, especially sometimes the woman, the people, the husband or the father, the guardian, they will say, no, we are going to sign or we are going to consent for her. This is not acceptable except in one case. Suppose you have a patient, male or female, you have a suspicion that it's a tumor cancer, and the patient told you, please, I don't want to know the result. Sometimes, yes, the woman will tell us, please, if it's anything, don't tell me, I don't want to know. Tell my son or my daughter or my husband, whoever. So this is one thing. The other thing, this is the respect of the autonomy of the patient. She should be the first one to know. In private hospital, unfortunately, sometimes once they get the biopsy, they will call the husband or they will call the father. Please come, we will discuss the case with you. They don't have the right to discuss the case, as I said, except if she requested that. So you have to be careful because this is the right of the patient. And sometimes people will tell me or ask to report the case to their son because he is very old man. Okay, it depends on your experience, because if I have an elderly who have Alzheimer, who has multiple disease, high-risk patient, yes, we do respect that one, and we know how to break bad news. You and me, we took lectures, we know in the practice how to break bad news to this group of people. Because if he is, for example, has Alzheimer, he might not follow even the protocol of the management. This is a special case, but in general, no. Woman as well, if she wants to know the result, she must receive the full closure, and this is one of her rights. If you disclose this or break this news to somebody else, be careful, because I always say when I was a young graduate in the 80s, people were not aware of their health rights like now. Now, this is why we can health rights like any other people. They have the right to know, to be empowered, and sometimes to consent for themselves. But this is to accept or refuse the treatment. This is depending on their capacity. If there's a patient, you think that the capacity is very poor, of course, in this case, the guardian will be the one who takes the decision. Like the minors, the children. The children usually, and even the children, it's not all the children. Sometimes we differentiate between 13 years old or 16 years old. And the system of the guardianship, you have to be careful, because when you say the guardian will take over in consenting, the consent of the guardian should be in the best interest of the child or the mentally disabled. Because if you have a mentally disabled patient, and for example, they need chemotherapy, like cancer patient, and the guardian said, no, I will not consent or agree to chemotherapy. And you know that if you don't give the chemotherapy, this patient will have metastasis within few weeks or months, or she might go from stage 1 to stage 3 and deteriorate. The guardianship system is not authority مطلقة. It's not completely in his hand. If it's not in the best interest of the child or of the disabled, the guardianship will be transferred to somebody else or to the doctors, أو حتى للأمارة, the regulatory body in your area. Okay, thank you.
Thank you very much, Doctora. So there is also extra 2 questions, but they are general questions. So I think we will answer them at the end of our presentation. So if you don't mind, we would like to go to the next case.
Sure. Yes.
Okay, so in this case, we're going to discuss, is termination of pregnancy as choice of the wife or the husband? So a 35 years old Gravida 3 Para 2, which is her 3rd pregnancy, and she has 2 children. At her first appointment, ultrasound at around 18 weeks showed severe congenital abnormality. The husband requested termination of this pregnancy, but the wife refused as she was scared of complications of termination. So you, as a healthcare provider, how would you solve this problem medically, ethically, health rights aspect, and from Islamic perspective? You will respect the husband's wish as he is the legal guardian, or you will respect the wife's wish and do not do the termination? Or are you going to refuse to terminate her pregnancy as it is illegal to terminate according to Ministry of Health of Law? So I'm going to raise the poll question right now, and please share with us your opinion. So we would like to invite everybody to participate. We're going to leave this poll question for 60 seconds for everybody to participate in. So let's remember that this woman is pregnant 18 weeks, and the ultrasound showed severe congenital abnormality. And she was advised So what would you do in this case? Dr. Samia, I'm sharing the results right now.
Yes, thank you very much, Lamia. You can, okay. Now, let me start with the third number C, because it's amazing. I can see that around 50%, they will not do the termination because according to they think that according to Ministry of Health law, it's not allowed in Saudi Arabia. Let us clarify this very clearly. Abortion in Islam is not allowed, is forbidden, except, you have to understand that we have a window for termination with certain criteria. Termination is not forbidden completely. This is very important to understand. The other thing, we have the situation, it depends on whether there is a maternal indication or a fetal indication. Can we have the next slide, please, Lamia? First of all, if this termination is for example, social reason, she got pregnant and she's still lactating her baby, she doesn't want to have more children, these are relative issues, and باب الاجتهاد اللي هو we have scholars views, different scholars views, depending on the gestational age, on the reason, requesting termination, etc. But these are variable, okay? And especially during the first 40 days of pregnancy. What is more important is if the reason for termination is for fetal indication, that there is something wrong with the baby, or there's something with the mother. If it is for something related to the fetus, like in the case, there's congenital abnormality, and we mentioned exactly the term severe congenital abnormality. What does it mean? If you have an ultrasound result showing, for example, this baby or fetus is having signs of Down syndrome or having cleft palate or lip palate, these are not severe congenital abnormality. These are not the one that are allowed you to terminate at all. What we are talking about is severe congenital abnormality incompatible with life, or if the life of the fetus will be miserable, like he will be completely handicapped on whatever, breathing problems, whatever. So the الرؤية الشرعية from Islamic perspective, if you have these reasons, then yes, we can terminate if the case is that case, but we have to get the consent and the approval from both the mother and the father. Why? Because the offspring, the pregnancy, the fetus, حق لكل الطرفين. The father and the mother have to say and agree about termination. I cannot do termination except if I have a major abnormality, except if both parents agreed, except after approval of the ethical committee in the hospital. Now, suppose that the father, like in this case, he wants termination, but the mother refused. Sometimes you will be surprised. Some ladies, they will tell you, we know that is severe congenital abnormality. We know it's incompatible with life. We know that all these, after counseling with them, but she will tell you, I'm afraid from the termination. She is aware that termination as well is not easy, either medical termination or surgical termination. All have risk and complication. وأحيانا the Islam, the faith, some people, you will be surprised, she will tell you an answer, أبغى أخذ الأجر وأكمل الحمل. I say it in Arabic because in English, for those not speaking Arabic, some people, they will believe that this is something that if they tolerate, they will have reward from Allah. So if the mother refused, and this is one of the things in Islam to honor woman, we cannot terminate except if she agrees. This is the health right of the mother, because termination means we will give the mother, not the father, something medical or surgical, subject her to this. So if the mother refused, no termination. The other, this is the fetal indication. But if you come to the maternal indication, suppose you have a lady who have cancer and you want to start chemotherapy. Suppose you have a lady who is having serious medical problem, and you know as physician that if she continue the pregnancy, this will affect her health or might lead to death of the mother. If it's for maternal causes affecting her health or life, serious effect, then I don't have to have the approval of the husband. We counsel him out of respect, but it's not his choice to say yes or no. We do the termination because in Islam, we have 5 important issues. Preserving life comes first. مقاصد الشريعة 5 على رأسها حفظ النفس. And this is to preserve life of the mother is a priority. And this is not a choice. We usually, most of the hospital, in any case, they will not approve the termination except after committee approval, after ethical committee approval. The last thing which you have to understand as well, in Islam, we can do termination for some cases, as I have explained, but it could be before 120 days of pregnancy. Why? Because before 120 days, there is no ensoulment of ruh, nafkh ruh. After that, it's not allowed, except if there is a serious thing will happen to the mother. Before that, this is the area, let us say, area where you are allowed to counsel do determination before 120 days. After that, there is no law, Islamic law or law of menstrual health will not allow you, except if there is something really going to cause death of the mother. Okay, but
Yes.
don't take it lightly, because still termination is not an easy thing, medically, socially, psychologically.
Okay, thank you very much, Doctora. So we have actually very interesting questions in the Q&A box. We have only 10 minutes left. So I'll move on to the next case if you agree. And then we will read these questions and answer them live. So the next case is about children health rights. So in this case, Sarah is a 2-year-old child. She was taken by her mother to the emergency room because she held her wrist and cried. The mother claimed she has fallen from her bed. The emergency room doctor requested an X-ray. When the radiologist reported Sarah's X-ray, he noticed signs of 2 healed fractures, in addition to the new fracture. The child's bones otherwise appeared normal. He suspected child abuse as a possible cause of the fracture. He called up the consultant in charge of the emergency room. Mother was unwilling to provide any additional information. A complete examination was done to the child. The physician found bruises on Sarah's upper arm. So how are you going to proceed with this case? Are you going to, so as you suspected abuse, you will call the child protection team in the hospital? Or are you going to manage the case and discharge her without disclosing this information? or you're going to discuss the case with the mother, but if she denied any history of child abuse, and you will respect her words. So I will raise the poll question, the last in our last case, and I would like to invite everybody to participate in this poll. So if you suspected any child abuse based on this given case, what are you going to do? So are you going to call the child protection team in the hospital? Or are you going to discharge her without disclosing this information? Or are you going to discuss the case with the mother? So, Dr. Samia, I'm sharing the results on the screen.
Okay, thank you so much for everybody who answered that you will report immediately to the child protection. 84% have answered that they will report the case and call the child protection team in the hospital. This is a wonderful answer. It reassures me and everyone in the community that we do know the laws. By law, you are obliged, anybody who suspects these cases, you have to report immediately. You have to report immediately. If you are in the ER, if you are in the OR, if you are anywhere, child abuse and violence against women and these minorities, these are the one of the big problems in many societies. Since we had the برنامج الأمان الأسري, to be honest, we are grateful to the system and the law that we have this program for protection of the rights of those who are subjected to abuse. The other thing that you have to be careful because your priority should be the safety of that child. And you have to have a high index of suspicion. Don't just, sometimes some of us, they will examine the arm, okay, fine. No, look everywhere in the body to see if there is bruises, cutting, burns, anything. Usually the abuse happens to the younger kids, maybe the infants or those with the intellectual disability. And it's an agony when you find that those with disability, because they don't have the capacity to talk or to complain, they are subjected to sexual harassment, to rape, to violence, burns, whatever called abuse, they will be, even in دور الرعاية, even in the what they call it when they have in the, when they are in the special care units. So you as a healthcare provider, you have to know that it's your responsibility to report these cases, and this is important to document in the file, because you will protect yourself as well as protecting the child. Protection, it's not only to the victim, it's always as well to the healthcare provider. So violence against children and against women, this is a very great critical area. And the last comment, remember that during crisis, like pandemic crisis, like COVID-19, many studies and in practice have been proven that there is increase in the rate of abuse and violence against women and against children for many reasons. People at the lockdown, they cannot go and complain, they cannot reach hospital, the stress of the lockdown, so the children are subjected to more abuse more and more during COVID-19. This is about the virus. I think this is the last case, Lamia, right?
Yes, we have left only 3 questions in the Q&A, and we would like to review our references.
Thank you so much for everybody. And okay, if there's any question, Lamia, By the way, these are the references I put in the last two slides because if you are interested or if you want to have references, all these, I recommend that each medical student and each healthcare provider should have a look at these references. One of the references which I will as well recommend is the one with the website of this one, the website of the هيئة التخصصات الصحية, because this is the website that we from the Department of Health Empowerment have launched a few months ago, and you will find a lot of examples of these cases. Of course, the health rights bills, you will find it in the website of the Ministry of Health. This is very important reference as well. Thank you so much.
Okay, Doctora, I will read some questions, and I think we will extend only 10 extra minutes to answer these very important questions. So the first one is actually a statement, but I think Dr. Noura wants your response on that. So she's saying in an ICU setting, nurses are facing a daily dilemma related to unavailability of consent or for critical care. When a new neonate is delivered and admitted to an ICU, critical management is required immediately with no delay. The mother is still in the delivery room at the time of admission to an ICU, and the father is not always available to complete the consents. The medical staff immediately start the management without documenting the need for emergency procedure. So I think she's, Dr. Noura here, this is the whole statement. So I think Dr. Noura here is saying that sometimes they don't take the consent from either the mother or the father for a medical intervention needed for the child after delivery. So do you have any comment, Dr. Samia?
Yes, this is the, it comes under consent in emergency cases, whether adult, child, ICU, neonate, whatever. In emergencies, you don't have to have a consent or wait for consent because it's a life-saving measure. Two consultants will decide if, for example, you have a car accident and you have somebody who's bleeding and going to lose his life if you don't take him immediately to the OR. Or if this newly born baby, you have to intervene, but there is no consent. You don't have to have consent. Two consultants agree that it's a life-saving measurement and they go ahead.
Okay, we have another question from Dr.
I'm sorry for interruption, ya Lamia, because now you see, all of you, you see the slide. This is in Arabic, الدليل السعودي للإذن الطبي. Please, please, please. This is a wonderful book from the Center, Patient Safety Center and the Ministry of Health. And you have to memorize every letter and every statement and every word because it will help you and protect you very, very, very much. Nobody should graduate without reading that book. This is my personal opinion. Thank you so much. تفضلي يا لميا.
Thank you. So another question from Dr. Ragad Al-Faris. She's saying, if two persons are engaged and one of the parties has a disease that won't affect the other person and doesn't want the other one to know, is it their right? For example, person with anemia. This is the whole question, Dr. Samia.
Right. Which type of anemia? I mean, there are many types of anemia, but let us take it بالقياس in general. In general, I think transparency in this, in marriage in general, from the ethical point of view and the Islamic point of view, I don't think that it's right to hide such information from the other partner, because if he discovered that later on, the response will be fired back in a very bad way. Maybe if it is something, and I cannot think of, for example, if she means that if she has, for example, plastic surgery before, but she doesn't want to tell him that she had this, and it will not affect him. I don't have the clear answer. I'm not sure what's the correct answer, because there is no such law I came across to say this or that. But personally, ethically, and I think it's not right. But there are certain things, if you think that it will harm the relation, this is something else. I don't know, I hope you know I answer, because there are many things that I have thought of from this statement.
Because each case is different, so we can't all, if we don't have all the facts, we can't decide or answer.
Yes, thank you for your help. There are individualized answer depending on the individualized case. Okay?
Exactly, yes. So the last question we have for this session, I want to ask for a 45-year-old patient who had presented no relatives, and he came with his colleague only. The patient after an operation was in coma, but before the operation, she had informed the surgeon verbally only that his colleague will be his guardian. In this case, will the colleague be the legal guardian in charge of the health decisions for the patient or not?
Right. This is, there are rules in the law, and even recently اللي طلعوه حقت الحقوق الشخصية، وثيقة الحقوق الشخصية ولا نسيت اسمها. All of us, we know about it. In Islam, the guardianship arrangement has certain way, like for example, the more closer العصب فما بعده. There is certain arrangement for that. If there's nobody at all, if I have such a patient, I will definitely ask one of the people I trust in Islamic perspective, and we will raise the question to the ممكن إمارة, ممكن هيئة فقهية, to know, because I'm not sure if they can delegate this unless he is for sure nobody is there except that. This is applied maybe as well in terminal cases, like cancer terminal cases. And I would love my colleague who gave this question to tell us what they did in such case, if there was such a case.
Yes, so actually it's an anonymous writer, but anyways, it is also mentioned in the informed consent guide that was produced by Ministry of Health and the Saudi Patient Safety Center, اللي هو الإذن الطبي, دليل الإذن الطبي. It is also mentioned there that anyone who is an adult and with full capacity of their mental, with a good mental status, they can choose their own guardian. But I am not sure if saying it verbally is enough, or has it to be written or documented somewhere else. So we can all search for this answer and then write about it in a tweet or something. So this is very interesting question.
And I promise I will review this part for me to know and for you as well. And I will try to find the correct answer.
Okay. So actually we have a lot of questions that was posted after we started reading questions. And I would like to read one from Mujib Rahman. He's saying a patient was decided by a multidisciplinary team that the patient should not be resuscitated, but relatives are not convinced. In this case, what is to be done?
Okay, there are rules concerning the do not terminate, okay, do not resuscitate, sorry. There are rules and regulations. Those who deal with cancer patients, they know, and in hospitals, they know this. I think usually they do counseling with the terminal cases before they go in coma, and they ask the patient, what does he want? The dilemma is if it happens without discussing that with the relatives. I'm not sure, to be honest, as well. This is things in the terminal cases, extended consent form, إلى آخره.
And actually, that's why our topic today is very important, because there are a lot of missing information or missing answers that we need all to work together toward finding the answer for it.
Dilemma, sometimes it's dilemma, to be honest.
Yes,
and
exactly.
Every day we learn. Yani, I'm not pretending that I have all the answers. And sometimes even in the rules and the regulation of the Ministry of Health or other bodies, you don't have the full answer for every single thing. I know that the Dalil al-Saudi is an excellent reference, but I have cases which I don't know what is the answer, because nobody have ever presented as well these cases. But we are learning. We are learning together, and it's good that we are thinking of knowing the correct answer in such cases.
Yes. Okay, so thank you very much, Dr. Samia, for addressing this interesting topic. And on behalf of the Saudi Patient Safety Center, we would like to thank you very much for this participation and for our audience. As part of the Saudi Patient Safety Center efforts to provide you with timely topics and interesting speakers, we'd appreciate it if you would fill our survey or evaluation to be sent to you, that will be sent to your email. Thank you for joining us today, and we look forward to welcoming you in our upcoming webinars. Dr. Samia, any last words?
Well, thank you so much. Please, you as male and female, you have to be empowered with knowledge about your health rights. Not only because you are healthcare providers, but because all of us need to know our rights. Number two, don't forget that we are advocates for our patients. And we have to advocate for health rights of every single patient. The third thing, we are living in an era in the kingdom of women's empowerment and health rights and health empowerment. King Khadim al-Haramain al-Sharifain, he said it very clearly. في قرار كده دائما there is a royal decree I love to mention, number 33322 in October 2017, about spreading the culture of empowering people with rights, human rights, and on top of that, of course, health rights. So it's extremely important that we empower ourselves and those around us and our patients with these rights.
Thank you very much, Doctora. Thank you for all the soldiers behind the scenes. See you next webinar. Good night.
Good night.